We want to make sure that every Washingtonian has access to all the things that they need to thrive as Washingtonians. Since 2021, the legislature approved these funds for Washington to be able to subsidize access to healthcare plans for all Washingtonians, which includes, obviously, undocumented residents. The authorization to sell healthcare plans through the exchange, that happened 2 years ago, but then this year the legislature appropriated funds specifically to subsidize plans for undocumented residents. So that way we have more people in Washington covered with their plans and having access to quality healthcare, and in that way we have a healthier community, people who feel that they belong to the state because they know that they can have access to, in this case, affordable and quality healthcare.
Art is so incredibly important to health. I think seeing art improves people's moods, improves people's days. Being part of the process of creating art is a whole nother level of building relationships and connecting community. Urban Artworks is a Seattle-based nonprofit. Our mission is to engage youth, artists, and communities in the creation of public art that inspires connections and honors their voices. And we do public artwork and youth mentorship. So the VITA agency approached us for an art initiative to spread awareness around recent legislation to increase immigrant healthcare access. Part of that component is an art component, and so we worked together with the VITA agency to create what this project looked like, which included making the RFQ to distribute to local artists. We wanted this to be a community-driven process from the start, so have artists all across Washington. And the goal of both of the paint days is to raise awareness around this legislation, to increase immigrant access to healthcare, as well as to bring the community together to paint.
Art is a way to express different emotions and also different social justice and healthcare without directly telling people about it. I think it speaks to a lot more communities. It's really important to have this mural and art to be a way that different issues can also be expressed without just putting it out there and saying it instead. It feels really great, especially just all these people out here just spending their day just doing art and just making this whole mural a reality. I really just been passionate about bridging this social justice with art, as well as bridging the gap between minority communities and healthcare, quality healthcare and quality education. So it just feels really amazing to be able to have this amazing work come to life. Art's definitely important, not only with mental health, but also activism, representing all these crazy issues that still alter our world and lifestyles every day is something that's really important, and art is definitely one of those tools that can help with that. With my experience, I feel like art is definitely therapy and can just help anyone that really needs it.
I hope this mural impacts the team and the community here as a daily reminder that art and health can work together. As you know, wellness is huge in our communities right now, and working through art, whether it be our students or our staff, kind of like we're doing today, can help to calm you down, can help for you to be able to collaborate with your colleagues in the way that you normally would not. And so having this mural here will help us to appreciate the arts, help us to appreciate wellness in a way that maybe we don't think of on a daily basis when we are serving our clients.
Open enrollment for all Washingtonians who want to buy health insurance at an affordable price, November 1st of every year. It's a wonderful opportunity and a wonderful feeling to know that our communities are thriving and have the tools that they need to thrive in our state. So as a Latino queer person who's married to an indigenous Latino person, I think that it's amazing that we live in a state that cares about our communities. That is a wonderful feeling.